Hi friends, this is Parvati from OPRA Capsticky. Welcome to my channel. I need your support, so please subscribe, share and like my videos. Also, you can mention your valuable comments in the comment box. Today we are discussing here the Adrenergic Antagonists. This is the last section from ANS. Already I covered 6 chapters from the Lipin Code in the ANS. You can check the previous videos for the reference. Okay, in the first slide I mentioned the OPRA syllabus for biomedical sciences. In this section they included the pharmacology portions. Okay, so the 1.1 they mentioned their physiological processes and normal bodily function for all systems. In this section they are include the pharmacology portions mainly. So in the next slide I mentioned here the parasympathetic and sympathetic functions, whatever that, just for reminding everything, just read it and then we can go for the other section. Okay, so the next slide I mentioned the alpha 1 receptors, alpha 2 receptors, beta 1 and beta 2 receptors actions. These are also I mentioned here for reminding everything. Just read it, that slides, then start the adrenergic antagonists. Okay, so adrenergic antagonists, it's also known as adrenergic blockers. That means also known as its sympatholytics. Sympatholytics we know it help to reduce the body's fight or flight response. So the adrenergic antagonist means the drugs that block or reduce the actions of epinephrine or norepinephrine. These are called adrenergic antagonists or sympatholytics. So what are the main functions happen on there? If the adrenergic receptors, if block the adrenergic receptors, what is happening on there? It mainly leads to decrease in heart rate, blood pressure and other physiological responses associated with stress and anxiety. That means associated with the fight or flight response. These actions are reduced. Okay. In the next slide, the classification in this portion we are discussing based on so many classifications. Okay, the first classification is based on the type of adrenergic receptor. They block mainly the first one alpha adrenergic antagonist, and the next one in the alpha adrenergic antagonist again they classified into non-selective alpha antagonist, selective alpha 1 antagonist and selective alpha 2 antagonist. Okay, the first one is non-selective alpha antagonist. That means it block both alpha 1 alpha 2 receptors. We know non-selective means alpha 1 and alpha 2 receptors, they block both. Okay, examples of phenoxybenzamine, this is classified under in beta haloalkylamines, phentolamine and tolazoline, that is imidazoline alpha blockers. Ergotamine means it's coming under ergot alkaloids, everybody know that. Okay, one of the points are very important in this section. This is mainly the common characteristics also we are discussing with this portion. Okay, the point I highlighted here, they are often used in the treatment of phenochromatocytoma. These drugs are mainly it's used for this one, phenochromatocytoma. Okay, phenochromatocytoma means that is a rare tumor that causes excessive release of catecholamines. Catecholamines we know adrenaline or noradrenaline, that means epinephrine and norepinephrine. Okay, this is called the phenochromatocytoma. So this point is also very important. Phenoxybenzamine, phentolamine, these are mainly used for the treatment of phenochromatocytoma. So the next classification is selective alpha 1 antagonist. That means it specifically block the alpha 1 receptors. Examples are prazosin, doxazosin, terazosin. These are mainly used for treating hypertension. And tamsulosin, alfuzosin also coming under this one. This is mainly used for benign prostatic hyperplasia. Okay. In the next classification we are discussing here, selective alpha 2 antagonists. Specifically, it blocks the alpha 2 receptors. Example is yohimbine. They are less commonly used and can affect the sympathetic outflow also. Okay, some of the important points also I highlighted here. Labetalol and carvedilol, we know these are mainly coming under beta blockers. So primarily these have the beta blockers and also with alpha blocking properties this have. Okay, so it's used for mainly high blood pressure and heart failure. Okay, the next point is chlorpromazine. Chlorpromazine is a phenothiazine antipsychotic and it's also used with alpha blocking effects. Okay, primarily it's treat for schizophrenia. One of the treatment for schizophrenia drug is chlorpromazine. Okay. The next one is tricyclic antidepressants. These are mainly used for depression with alpha blocking effects. These have also the alpha blocking effects. Mainly it inhibits the norepinephrine and serotonin reuptake. These are mainly the tricyclic antidepressants. Okay. Some of the important points, so that's why I just highlighted. Just read it. We can expect the questions based on this. Okay. Coming chapters we will discuss these things also. And the next one is the classification, sorry, not the classification. These are the common characteristics of alpha adrenergic antagonists. Mainly they are competitive antagonists. That means that compete with the alpha agonists like adrenaline and noradrenaline on alpha receptors. Mainly except the phenoxybenzamine. Phenoxybenzamine is a non-competitive irreversible antagonist. This point also very important. We can expect the questions based on this. Phenoxybenzamine is non-competitive irreversible antagonist. Okay. The next point is they reverse the means the alpha adrenergic antagonist. They reverse the hypertensive action of adrenaline and abolish the hypertensive action of noradrenaline and ephedrine. Mainly except the yohimbine. Yohimbine is a selective alpha antagonist. So the next point we are discussing here, they cause, that means the alpha adrenergic antagonist cause vasodilation. So vasodilation means it will we can use this one for treating the peripheral vascular diseases like Raynaud's disease, except the ergotamine. So these drugs have the vasodilation effects. Because of that, we can use this one in the Raynaud's disease. It's a peripheral vascular disease. Okay, this is also very important. We can expect the questions based on this. Okay. And except the ergotamine, the reason is it's a selective it's mainly it causes the vasoconstriction, and also the yohimbine because the reason it's a selective alpha 2 antagonist, so it's no effect on the alpha 1 receptors. Because of that, they didn't use this one for treating the Raynaud's disease. Okay. Then what is Raynaud's disease? I just mentioned the short note for understanding what is Raynaud's disease. It's a condition where blood vessels in the skin narrow in response to cold or stress, and it's causing fingers and toes to turn white or blue and feel numb or cold. Okay, this one is called mainly the Raynaud's disease. Okay. The next one is, the next point is selective alpha 1 blockers like prazosin are useful for primary hypertension as they do not block presynaptic alpha 2 receptors, causing minimal reflex tachycardia. So not that much side effect. It's showing only the minimal reflex tachycardia. Okay, because of that, it's mainly used for the primary hypertension. Okay, the next point is they relax. That means the alpha adrenergic antagonists relax the smooth muscles of the urinary bladder and prostate. So it's helping in maturation in BPH patients, benign prostate hyperplasia patients, with tamsulosin being the drug of choice. We already discussed this one, alfuzosin tamsulosin, mainly used for the BPH patients. Then the common therapeutic uses of alpha adrenergic antagonists. First one is peripheral vascular disease treatment. We already mentioned Raynaud's disease. It's used in the Raynaud's disease treatment. Then BPH treatment, that means tamsulosin, it's a selective alpha 1 antagonist. Because of that, it's used in the BPH. And then it's helpful for treating the hypertension secondary to phenochromatocytoma with beta blockers. Okay. So next one is treating rebound hypertension. Rebound hypertension means it is sudden clonidine withdrawal. It will causes the rebound hypertension. So this case we can use these drugs. Okay. So treating the rebound hypertension, that means and it's also used to treating the hypertensive crisis like it's allergic reaction. Hypertensive crisis means allergic reactions. One of the important hypertensive crisis is cheese reaction. Okay, and if extravasation occurs during IV infusion of noradrenaline or rapid rate of infusion of dopamine, in this case also we can use this alpha adrenergic antagonists. Okay, these are very important. In this slide, whatever I highlighted in dark bold color, it's very important. Please tarot with these points. We can expect the questions based on this. Okay. And the next one I just mentioned, what is cheese reaction? We already mentioned it's a hypertensive crisis, that means allergic reaction. So cheese reaction means mainly it's caused by consuming tyramine rich foods like certain cheeses. Some of the cheeses, it's contained high rich of tyramine. Okay, while it's taking with monoamine oxidase inhibitors, MAVA inhibitors, it will lead to a dangerous spike in blood pressure. This one is called the cheese reaction. Okay, very important point. Please tarot with this point. Okay, and the next one is specific therapeutic uses. That means some of the alpha adrenergic antagonists have a specific uses. The first one is selective alpha 1 blockers like prazosin. It's a selective alpha 1 blocker. It's mainly used to treat primary hypertension. That reason we already discussed this one, because of less reflex tachycardia. Because of that, it's mainly used for the primary hypertension, treating for the primary hypertension. And it's also used for congestive heart failure by reducing venous return and total peripheral resistance, which helps improve cardiac output. And the next one, we already discussed this one, tamsulosin. It's a selective alpha 1 blockers. Mainly it's used in BPH patients. Okay. Then the common adverse effect of alpha blockers. First one is for postural hypotension, because it's decreasing the BP, arterio and venodilation. Because of that, it's postural hypotension. So it's avoided in all patients. Postural hypotension, what is postural hypotension? Everybody knows, suddenly changing a position. Because of that, it's showing the postural hypotension. So we want to avoid in all patients. Okay. The next one is main side effect is tachycardia. Tachycardia means increasing the heart rate. Okay. Next one is nasal congestion. Nasal congestion, we know the vasodilation is happening on there. Because of that, nasal congestion. Okay. Sexual dysfunction means failure of ejaculation in males. That is sexual dysfunction. And dizziness, headache also it's showing. These are the main adverse effect. Okay. And the next classification, it's beta adrenoreceptor antagonist. First we discussed alpha adrenergic antagonist. So next one is beta adrenergic antagonist. That means beta blockers. Classification, the first classification of beta blockers is classification based on to the selectivity. So the first one is non-selective beta blockers, first generation. That means from the heading we can understand that it will block the both beta 1 and beta 2 receptors. Examples are propranolol, pintalol, oxypranolol, nadolol, sotalol, timolol. These are the main drugs coming under this classification. Next one is cardioselective beta blockers. That means selective beta 1 blockers. That is second generation. So examples are, the first drug is atenolol, second generation, and it blocks the beta 1 receptors. So the selectivity can diminish with large doses or prolonged use. Okay. Examples mainly atenolol, acebutolol, bisoprolol, betaxolol, esnolol, metoprolol, nebivolol. These are the main drugs we are discussing. And the next one is antagonists of both alpha and beta receptors. Okay, that means it blocks the alpha and beta receptors. So labetalol and carvedilol, these mainly block the beta 1, beta 2 and alpha 1 receptors. Carvedilol, it also has antioxidant properties, beneficial in, so it's beneficial in heart failure. Okay. And next one is celiprolol. Celiprolol means this one mainly blocks the beta 1 receptor, and it's act as an agonist. That means it's acting like a partial agonist on beta 2 receptors. Next drug is nebivolol. Nebivolol, it selectively block beta 1 receptor, and it also act as a beta 2 agonist, and it release the nitric oxide, so it's causing the vasodilation. It's known as a nitrogenic beta blocker. Nebivolol is it's also known as nitrogenic beta blocker. The next classification is selective beta 2 blocker. That means it's only blocking the beta 2 receptors. Okay. One example is mentioned here, butoxamine. They have no clinical uses, only the experimental this one. Okay. The next classification, it's based on according to their degree of lipid solubility. The first one is lipophilic beta blockers. Mostly the beta blockers fall into this category because they can easily cross the cell membranes and the blood-brain barrier due to their lipid soluble nature. So from the heading we can understand lipophilic beta blockers means it's lipid soluble nature. Hydrophilic beta blockers means these have lower lipid solubility, making them less likely to cross cell membrane and blood-brain barrier. The main examples, this one, nadolol, atenolol and sotalol. These examples are very, very important. So please thorough with these examples. We can expect the questions based on this. So easy to remember the hydrophilic beta blockers, except this one, everything it's coming under mostly the lipophilic beta blockers. Okay. The next classification is based on according to the membrane stabilizing activity. The first one with the membrane stabilizing activity, so it's blocked the sodium channels, additional anti-arrhythmic action is producing. It's okay. Examples are propranolol, metoprolol, labetalol, pindolol. Okay. The next one is without membrane stabilizing activity. That means it do not block the sodium channels. Examples are nadolol and atenolol. Okay. These examples are very important. So please thorough with this one. We can expect the questions based on this point. So if you understand the classifications thoroughly, you can choose the answer very easily. Okay. The next classification is according to the intrinsic sympathomimetic activity. That means pure antagonists, the first one, block beta receptors without initial stimulation. Examples are propranolol, atenolol, metoprolol, nadolol. And with the intrinsic sympathomimetic activity, that means it's partial agonist activity. It stimulates the beta receptors before blocking them. Examples are pentolol, oxypranolol, and azabutolol. The first drug we are discussing here, non-selective alpha blocker, phenoxybenzaimine. Okay, phenoxybenzaimine, the mechanism of action is it's a non-selective, so it's linking covalently to both alpha 1 and alpha 2 receptors. And it blocks their function, and it causes the vasodilation of blood vessels, which leads to drop in BP. We know the vasodilation means it will drop the BP. This drug is often used to control the hypertension. So we can use this drug in the hypertension cases in conditions like phenochromatocytoma. Okay. This is very important, and one of the important drugs for treating the phenochromatocytoma is phenoxybenzaimine. Please thorough with this point. We can expect the questions based on this. And the block is irreversible and non-competitive. This point already we discussed in the first common characteristic. This is also very important point. Okay. And the next one is what are the pharmacological actions of phenoxybenzaimine. The first one is it blocks the alpha 1 receptors. It's similar to phentolamine, one other classification drug coming under in the same classification. Other example is phentolamine. So it's similar to phentolamine. Phenoxybenzaimine inhibits the action of alpha 1 receptors, and it's leading to vasodilation and decrease in BP. Next one is pharmacological action. It's also blocked the alpha 2 receptors. That means it increases the norepinephrine release. Next one is it block H1 receptors. Phenoxybenzaimine has antihistaminic effects also due to its ability to block histamine H1 receptors. Okay. and it's also blocked the 5-HT receptors. That means it acts as an anti-serotonin agent by inhibiting the serotonin receptors, and it's also blocked the muscarinic receptors. It also has anti-muscarinic action similar to atropine affecting the muscarinic receptors. The last action is inhibit neuronal uptake and extraneuronal uptake of noradrenaline. Phenoxybenzamine prevent the reuptake of norepinephrine and enhancing its effects. Okay, these are the main pharmacological actions. Please thorough with these actions. Okay. The next one is therapeutic uses of phenoxybenzamine. The main important use we already discussed this point, phenochromocystoma. That means to control the BP and manage the effects of the tumor which secretes excess catecholamines. The next point is it's also used for treating the Raynaud's disease and frostbite. Raynaud's disease, what is Raynaud's disease? We already discussed. And frostbite means is an injury that occurs when exposure to freezing temperatures causes the skin and underlying tissues to freeze. This is mainly means the frostbite. Okay. Next one is what is the adverse effects of phenoxybenzamine. Mainly it's causing the postural hypotension. That means the sudden drop in BP upon changing the positions. The next one is inhibition of ejaculation. That means difficulty or inability to ejaculate. Okay. Tachycardia means we know about that one. Tachycardia means it's increase the heart rate significantly, first the heart rate. Okay. The next one is nasal stuffness, nausea, vomiting. These are also the common adverse effects of phenoxybenzamine. Next one is contraindications of phenoxybenzamine. The first one is very sharp drop in BP is undesirable. It can cause severe shock. So we already discussed because of the postural hypotension. Mainly we want to avoid all patients. We want to avoid in all patients this drug also. Okay. The next one is after cerebrovascular accident, that means stroke. If the patient's recovering from a stroke, should avoid the phenoxybenzamine. In the recovery period after acute myocardial infarction like heart attack, mainly we want to this drug in related the patients with the cardiovascular diseases like heart attack, congestive heart failure, cerebrovascular disease, or the renal damage. We want to avoid this drug for a time period. Okay, or otherwise we want to take the caution with this drug. Okay. Then the next one is respiratory infection. It can increase the aggravate the symptoms of this respiratory infection. So because of that we want to caution with this drug. Okay, these are the main contraindications. Okay, so today I am just wind up the video here. Remaining that we will discuss in the next class. I will try to complete in the next class for the ANS. Okay, thank you.